ourselves.
Well, you do first ladies.
Okay.
Yeah.
Okay, we
Mm-hmm.
are Retire in Panama Tours. I'm Megan. I am operations director. So if you come on one of our tours, you'll get a lot of emails from me making sure you're ready for your trip to Panama. And I'm originally from Pennsylvania, graduated from Penn State University, and came down here with the Peace Corps and served here in Panama for 2 years. Learned a lot about the culture and the language, and in that time met these guys. And the rest is history. I'm a full-time Panama expat now.
Yeah. My name is Oscar. I'm originally from Cali, Colombia. I've been in Panama for 13 years, a little bit over 13 years, before leaving Costa Rica, working in the hotel industry and hospitality. In the company, my role is I'm pretty much a little bit jack of all the trades. So I am going to be the one taking care of you, showing the culture, showing this beautiful country, explain you why things are done here in Panama, some of the best spots to show you, all the good connections, all the good vibes that this beautiful country has to offer, always with respect about as well about this country. So here I've been here for working with the expat services since 2010, since I attended my first seminar, International Living. So I love this job, love this community, love this country, and well, now I'm gonna let this guy talk. He always complained that he doesn't talk.
We don't have any time left. You took it all. Okay. I'll go very fast. Rod Larrabee, Vancouver, Canada. Been here 11 years as of last week. I met this guy within my first few months here, and I needed somebody because I was one of these expats that didn't have any of the answers. And I got involved in with there's people here that want to take advantage of you, and I had that happen to me. And Oscar pulled me out of it, and from that moment on, we've been best friends, business partners, some different ventures. But right now, our main venture for the last several years is Retire in Panama. That is our company. We do a group of 10 to 12 people every single month, bring them to Panama. But that's not what this call is about. So we're not going to be selling you our products here. This is not going to be one of those calls at the very end. We're going to give you a dollar amount of where you're going to get the information. Whatever you ask is going to be answered tonight. And you're going to get the contact information of all the people we talk about. There's an email. So don't ask for the contact in the chat, because at the end of the call, whether you hang up now or whether like at 9 o'clock or whenever the system sends it, you're going to get all the contact information. You're going to get 5 different PDFs with the different information that we discussed in the different topics. So you will have that all, and there'll be information for all over the country. So anyhow, we're going to get started. Magda, if you can come on screen with us by clicking the microphone and video button. Now, Magda gets to go first. Why? First, who is Magda? Magda's been in the insurance business in Panama for many, many years. She is the choice speaker of international living, even on their international, not just the Panama one. She just spoke in Atlanta. She was very honest and very direct about healthcare. And she is going to be talking tonight about international healthcare plans in the private hospital system, which is basically like most of you are North American. So it's basically like healthcare back home. Good quality healthcare, no cost because there's no deductible, no copay. Obviously, there's a monthly cost to it. But we'll get into all that. And Magda, can you please present yourself?
You
Okay.
it says no image, no sound. You should be able to click video and microphone at the bottom to be able to turn on your microphone and sound.
Yeah. No, this lady's saying that Magda.
No,
yeah.
Magda also wrote that there. Magda Crespo, no image, no sound.
Hey, Magda, were you just there? I know you're there.
Let's see if we can get her on here.
Okay, Magda why she's going first is she is, look where she is, guys. I just pulled up a map. Oh, no, you can't see that on my screen. She is in Portugal right now.
Just around the corner.
She is.
There she goes.
Can you hear me?
So it is now 7 minutes after midnight. Sorry for waking you up.
Hola, Magdita. ¿Te escuchas? Magda,
Can you hear us?
¿nos ves?
Turn your volume up.
1, 2, 3.
Yes,
Ajá.
we can hear you.
Can
Perfect.
you hear me, Rod?
Sí.
Yes, we
We
can.
can.
¿Nos escuchas? I probably she's not listening.
Mhm.
¿Nos escuchas, Magda?
Magda, we're ready for you. Oh, she doesn't have her laptop. She's traveling with her phone.
Right.
We'll give her 1 second, guys. Just try the
Can
volume
you
on your.
hear me now, Rod?
Yes, we can.
We can. Can you hear us?
No se escucha.
Hello, can you hear us, Magda?
Magda.
Maybe text her to check that her Bluetooth isn't connected to something else.
Yeah. You got your Bluetooth
1,
connected
2,
to?
3.
No, she's not
¿Me
listening to us.
escuchan?
What you saying?
She's not listening to us.
If we can hear her, which we can, but it doesn't seem like she can hear us.
I'm glad you can hear me, but I don't hear anything.
No lo escuchas.
Okay, Magda, you can hear me. Start your.
I'm sure Rod will fix it in a minute.
Look at your WhatsApp.
Magda, look at what's.
Yeah.
Well, she's on the call too.
Yeah.
Everything
She
on her
probably
phone.
can't see the
There
chat.
she goes.
Hello. Sorry about this, guys. We will get this going shortly. Please be patient. So Magnus, we just asked her to start. She has a 15-minute presentation about international health insurance, how it works in Panama, what it covers, what it doesn't. So we are just going to.
Well, hello everybody. Good evening. Welcome to this Retire in Panama webinar. My name is Magda Crespo, and my expertise is international health insurance. I will explain quickly to you what it's all about it. But international health insurance in Panama is working very well for expats and all of those foreigners who would like to live here in Panama. Um, Basically, what we need to do is quote you, and everybody quotes will go according to their age. But there's one important thing you need to know. You have to apply to this international coverage before you turn 75 years old. 75 years old is the top age to get into the plan. But once you are in, you will be covered up to age 100. Okay? Since I don't hear much of anything here, let me check if somebody's asking something here. Yeah. Pose any questions. Okay, I
Okay.
will. Okay, perfect. It looks like you can hear me, even though I cannot hear you. Some people is writing to me that you can hear me. So the age limit to get into this plan is 75 years old. It's a plan suit to Panamanians, but that means that pre-existing conditions might not be covered, except for things like high blood pressure, high cholesterol, some mild diabetes, things like that that you have control with medication. But pre-existing conditions, like if you already have an event, if you already had a heart stent, a heart attack, a stroke, or for example, if you already have, in case of women, breast cancer will not be covered, but other type of cancer will be. So that's very important because these plans are sued to Panamanians, and according to the insurance in Panama, the companies do not cover pre-existing condition. But if you have any, bring please your reports from your doctors. Basically, that will state when did they diagnose you, what medicines are you taking, and if you're doing well in the treatment, and positive things. Um, the international insurance will cover you in Panama 100%. It's not There is no co-payment, and there is no deductible for any accidents like a broken leg, car accident, concussion, cuts, accidents like those. 100% coverage with no deductible for emergencies such as very bad pain, chest pain, very high fever, um, very bad pains anywhere, a snake or scorpion bites, all of those emergencies. If you walk into the emergency room, you will be fully covered with no deductible under this international plan. But like the word says, is international. Outside Panama, you will be covered also at 100% after deductible. See, once you complete your deductible, the company pays everything. Um, Another very important fact about this plan, let me check the chats just in case. Uh, okay, we're doing okay. Another fact is, with this plan, you need to stay in Panama 6 months of the year. See, that's a requirement. The other 6 months of the year you could spend everywhere else except Canada, United States, and Brazil, where you can stay maximum 3 months in a row. See, so 6 months minimum in Panama, and the rest of the other 6 months you could spend in other countries, but in Canada, United States, and Brazil, only 3 months in a row maximum. The company has a very good insurance backup in the States, Canada, and everywhere in the world. In United States, for example, we use United Healthcare, but we also work with selected providers like Mount Sinai, the Presbyterian Hospital, Cleveland Clinic, Mayo Clinic, and other hospitals that work in our network, making every payment direct to the provider. You don't have to come up with a payment. You don't have to pay anything up front. You show your carnet and off you go. And that's one of the beauties of this plan. You will feel that you are working with a plan you already know, and a plan that you are used to. See? Uh, this is pretty much the facts of the international plan. The companies I work with usually are Worldwide Medical, Bupa, Boomi, there are others, but honestly, I've been working very well with Worldwide Medical, and that's the one I recommend to any of you. Um, okay, Rod, I don't know if I should answer any questions or if there anything that come up from other people. If everybody's hearing me, can you maybe give me a chat or something?
Hey guys, sorry about the live Q&A with Magda might not happen because she can't hear us.
This
But
plan is not only for hospitalization. It covers outpatient in Panama also, but after the deductible. What you should know is that most of the companies will not cover at 100% and will not waive the deductible. But this company does in case of accidents, emergencies, and hospitalizations. So, for example, I had a kidney stone one day that took me into the hospital. And when I was hospitalized, they discovered that I also had stones in my gallbladder. So the doctor told me I needed to get it out. I programmed that surgery 2 months later, and I don't even know how much it was. They cover in full, and I didn't pay anything because accidents, emergencies, and hospitalizations fully cover at zero deductible with this plan.
perfect. Okay, the name of the company, you're actually going to get their brochure at the end of the call.
If you
And
spend 6 months in Canada, it won't work. If you spend 3 months in Canada maximum, and then come back to Panama, stay for a week at least, and then go back other 3 months to Canada, that will be okay. But not 6 months in a row. Okay.
Magda's hitting the important questions. That's good. Um,
This company also have a very good catastrophic plan. Um, but this plan, no deductibles in Panama either, but you have to apply early because this plan will cover you for accidents and COVID and emergencies right away. But for illnesses, it has a 4 month waiting period. This is the catastrophic plan that is working also very well for many of you. Let me look at the questions again.
yeah, the catastrophic plan can bring your price down a little bit too, because you don't really need insurance to see a doctor here. It's $15 to $25. Yes, you can see a doctor without.
Premiums goes according to everybody's age. But for example, a catastrophic plan for a 60 years old person will be around $3,200 per year. Um, that's for you to have a more or less an idea of the price. But I have to quote each one of you according to your age.
Mhm. Yeah,
Yes,
Dan,
the company name is Worldwide Medical.
you're going to get their
I'm
brochure,
looking
guys,
at the
and
questions on the
their
chat.
contact numbers and Magda's contact numbers. Um,
Uh, yes, the policy has some brackets of years when they come up with a price. Usually, every company come up with a price once a year according to the inflation of the market. Some according to your age, but most companies use a bracket of 4 or 5 years to change the price according to the age. No, the maximum age or the limit age to get into this plan is 75 years old. In a case of a long period of remission from any type of cancer, the company will need all the reports from the doctors to analyze each case and tell you, well, yes, we will cover now that same cancer or not. But we have to provide the company with the information from your doctors. The difference between international health insurance and catastrophic uh, is not whether it's international. Both are international. But the catastrophic plan in Panama is only for accidents, emergencies, hospitalizations, and in case of cancer diagnosis, will cover only for chemotherapy and radiation therapy. The other plan, which is a complete plan, will cover for everything, but will waive the deductible for accidents, emergencies, and hospitalizations. It will cover the rest after the deductible.
When you get Magda to quote, have her quote you both. That way you can look at both
I
plans and
Somebody's asking me something about a plan UHC. I don't understand those letters. Can somebody
UHC
help me with that, please?
coverage.
Ah, no, United Healthcare works like through a contract with us under one of their PPO's plan, but you cannot transfer the one you have there. You have to get it through our company here because there are different policies from the insurances in Panama and United States and many other countries. So no. This plan, like if you have Medicare, for example, and you want to treat yourself in United States for any treatment or surgery, but you have Medicare will be your primary policy. Same with VA, and your secondary policy will then be Worldwide Medical. Those people that are over 75 years old have an option with the family medical care plan, but I think that somebody else is going to talk about this plan later on.
Yeah. Okay.
Cigna has an online plan, and Blue Cross Blue Shield has his plan with a Panama is a Panamanian plan by Blue Cross Blue Shield, but it's not the same one that you have in United States. And Cigna doesn't have an office in Panama, and that's very careful. And I'm gonna ask you to be careful with that because they sell you everything you want. But when it comes the moment to place a claim and get reimbursed, because that's what they do, then it's tough to get it.
hmm And I've seen quotes of Cigna of over $7,000 a year for people in their 60s. It's crazy. Okay.
To this plan, anyone can apply for Panamanians or foreigners, anyone. So it's a very good plan. I have clients that work with this plan in Hong Kong, Singapore, Germany, France, Canada, United States, Mexico. So it has proof that it's really and truly international, and it's not by reimburse. They pay direct to the hospital.
Mhm. Okay. So,
No, you can send me an email. I think that Rod is gonna give you all the information. You can email me, send me your birth date, and I will send you a quote right back.
hey guys, like I said, at the end of this call, look for an email and will be an
Okay, I
attachment.
think that that was all my time with you. Again, thank you for your time, and I hope you make it and get here soon. I'll be there to help you as much as I can. Have
Thanks,
a good
Magda. Go to
evening.
sleep.
Qué linda, Magda.
She made it work. Beautiful.
Okay, quickly, because we got 3 or 4 minutes. See, we're staying right on time. Back, neutral, spinning, similar. Any specific questions? We're certainly not going to answer, but general ones that I know. Premiums, we talked about that. $3,000 to $4,000 in your a year in your 60s and 70s. Once you got to apply by the time you're 75, folks. Once you apply, you're in there for life. So if you're over 75, you can't get. No one's selling international plan. Yeah, someone said you can only stay in Canada or the US 3 months at a time. So if you're in the 50s in the US and trying to get a $300 a month healthcare plan, this won't work. One thing to remember, guys, I bring this up. It's a touchy subject, but most of you are paying for Part B, like $170 a month. If Panama's your home, meaning you're going to live here, you already bought the burial plot, you can cancel Part B and because an international plan becomes your supplement when you go back and visit the States. So you don't need both. So, but don't cancel your Part B if you might move back to the state. There's a 10% a year penalty. So it can cost you a few dollars. Yeah, Signal, Blue Cross, no. Medicare Advantage, why do we need worldwide Medicare? Medicare, this is a great question. Medicare Advantage covers U.S. residents when they're traveling abroad. So if you're living here 5 months a year, 5 to 6 months a year, you can take advantage of your Medicare Advantage program and just use that. You're going to have to pay out of pocket. So, and a major emergency like serious car accident, heart attack could be $30,000, $40,000. You have to pay that. If you cannot pay it, you will go into the public system, and we'll talk about that in a second. And then once you pay it, why it doesn't work for people who live here? Once you pay it, once the doctor clears you here, you got to go home. You got to go home and see a doctor there to continue the care. It does not cover you here for a second incident or a reoccurrence of that incident. So that's why you got to be careful of if how Medicare works for you here. Lots of good. Does the policy auto renew once you're in? Yeah, once you pay monthly, you'll see. I use one of the ones that and Oscar and Megan that they recommend and that Magda recommends, and they just build my credit card every single month. Sorry, guys. Do you guys want to jump in something here? Mm-hmm.
No, it's going well. I think
you got a couple more questions here.
Sure. Got lots of thank yous to Magda. We'll be sure to pass those on. Let's see. Does the insurance have any connection to the Pensionado visa program? Nope. As if you come here on the Pensionado visa, you have your choice of insurance once you're here. Not connected. Mm-hmm. Yeah.
Okay.
We hit all of them.
I apologize for that. That was one of our guests. Unfortunately, Dr. Shannon had to cancel due to an emergency. So we'll do a private interview with her and share that with you guys in the next week or two. Okay. Mm-hmm. Yeah, we'll do that instead. Burnout plot, recommendation. Thank you for that. You pay out of pocket for Medicare. And take, yeah, if you get reimbursed and one if I can get insurance, very healthy person, roughly how much would it be? Okay, there again, guys, we're not answering questions about how much is my insurance. You just email Magda once you get her information at the end of the call and with your birth date, and she will tell you how much insurance is going to be. We're going to bring on another insurance agent. Carla, do you mind clicking on your microphone and camera and coming onto the call to join us? Carla Gonzalez is from MGM Insurance out of Panama City. And hey, Carla, how are you doing?
Very good, and you? Hola.
Buenas noches.
Buenas noches.
And she is, when I called up the owners of Family Medical, who are underwritten by Pan American Life, this is the lady they connected me with. Like, this is the one they said, use this person. She's good. She knows what she's doing. So we are going to talk about local health care insurance, like not the international, not the big pricey international plans, but we're just the local plans. We're also, Carla, they're going to get the brochure. So you can talk right about the brochure. They're going to get that at the end of the call with your name and number on it. But basically, what is family medical care?
Okay. Family medical care is a health insurance policy that will cover you, as you mentioned, here in Panama. It's a local coverage. It works with two different hospitals. In Panama City, it works with Hospital San Fernando and also in Coronado, which is one of the best hospitals in the country. And it also works in Chiriquí with Hospital Chiriquí and Hospital May Luis, which are the two biggest hospitals there. So the rates go from different brackets depending on your age. When you get the brochure, you will be able to see some of the rates. And I can also do a quotation if you send me an email. It has a very particular benefit, which is about pre-existing conditions. Most of the health insurance programs that work here in Panama, when you have a pre-existing condition, two things can happen. The first one is they want to approve the policy for you, the coverage, or the other one is that they can approve the policy, but they won't cover anything related to that pre-existing condition. So with this program, you can apply and the pre-existing conditions will be covered after a period of time. You can apply up to three pre-existing conditions with this program. And you will have immediately access to emergencies. Some of the other benefits do have a waiting period of time that will be seen in the brochure. And it's a very, very good program that you can apply for. If you are over 50, you will have to apply with some tests that will be required. The tests have to be done here in Panama when you come here, and you can apply with your passport if you don't have the residence here in Panama. So when you get out of the plane, you can contact us and we'll help you and guide you through all the process. It's very simple. We can coordinate all the tests and the evaluation for you.
Yeah, this is also an option, I guess, for some of the snowbirds, we call them, people that live in Panama for 6 months out of the year. Can they apply and get insurance for 6 months?
Yeah, you can apply even if you're leaving constantly, but to keep the policy, because some of the benefits have a waiting period of time, you will have to keep paying for
Yeah.
the service if you want to continue with all the benefits that we'll get after some time.
Just so, like most of us on our call, 50s, 60s, 70, you're looking at $100 to $125 a month for this type of insurance. Now, this insurance is a copay. So you do have to pay some at the hospital. So you show your card and you will pay 30% of whatever the bill was. So what other benefits? How about like emergencies? I believe that's 100%.
We have two kind of emergencies in this program. If you are going in due to an accident, it covers 100% up to $500. If the bill goes up that amount, everything that comes after will be covered on a 70%. So you will do a 30% copayment. And if it's a critical disease emergency, it's covered on a 70%. Most of the coverage is on a 70%, I'm sorry, with this policy. So you will always have to do a 30% copayment when you use this coverage.
Yeah. A lot of people on this call from North America laugh when you say it covers up to $500 for emergency room visit. Well, guys, this is, you could fall off a ladder, break your leg. This insurance would cover your ambulance, correct?
Yes, it also covers
It will
the
cover
ambulance.
up to $500. It's cost less than $500 to treat you for a broken leg in Panama.
Yep.
So it's actually, an interesting thing when you think about it.
Yeah,
Um,
numbers here in Panama is are way different than North American.
I
And
was
sometimes when you go in the public sector, an ambulance, you're not gonna believe what it can cost. 50 cents
yeah,
from the
50
public
cents. Yeah, from the
from the
public
public
hospital.
system.
Mhm.
So
yeah.
it's just Panama. Even if you pay privately, it is so much affordable. Any emergency, you can go with a breaking arm ER in a private hospital. It will not cost you more than a few $100.
Great. Um, Now, that 75 age limit, we got people over 75 moving here. Now, we were talking on the phone the other day, and they are like this company used to be unlimited age. And when COVID hit, that changed. Now they're up to 75. What happens if somebody's 78 or 80 in good health?
Okay, they recently have given us the opportunity for people over 75 to
Mhm.
apply. You have to do all the tests and you will have a medical evaluation. Depending on the evaluation, they will determine if you can get this coverage.
Hmm.
Usually, policies are approved with a maximum of three pre-existing conditions. I can have none because I'm healthy, or I can have one, two, or three. That's the maximum. If I
Hmm.
have more than that, the coverage would not be approved.
Yeah.
But you
Okay.
can apply if you are over 75 now. That's recently. It just happened like 2 or 3 months ago.
Yeah, this is the brochure that you guys will get at the end of the call. It's going to explain a lot. It covers some funeral stuff for your young ones like Megan. It covers maternity, to eye surgeries after 36 months, like cataracts. So you can't just, oh, I have cataracts, I'm going to buy insurance. You can't do that. You got to wait. But then it will cover 70%. So you'll only have to pay 30%. So you'll get this. Carla's email address and her company and her website are on there. So you will be able to ask her any questions. What else do you have for us, Carla? Anything else you can tell us of why you like this plan and you have represented it so long?
Well, I have been working with this program for almost 13 years. It's a
Yeah.
very inclusive program. It can give you a coverage that when you're calm, that you have something, like if something happens to you here in Panama, you have a coverage that will help you with. And most of our clients are from other countries and are very happy with the opportunity to apply with a passport, because some insurance here in Panama will require
Yeah.
that you do
Yeah.
have a residence here and that documentation. So yeah, that's
So,
very good.
yeah.
And yeah, a lot of clients are really happy with this program.
Yeah.
I see some questions here. I don't know if
Sure.
I
Let's see
can.
what they are totally, if they're totally related to this plan. Let's talk about them.
Yeah, I saw something here. Let me see. A lot of questions. Okay, isn't there because as a family plan? Okay, someone is asking here, as a family plan, would this work for someone 50 years old and include their mother? You can both apply, but it would be individual coverage for each of you. But like you can do pay for your mother's coverage, but she has to do the process of the test and the evaluation, and depending on that, they will determine if they can approve the coverage for your mother,
Yeah,
which is
it's called family. That's a wife or a husband and a underage dependent get discounts on the
correct.
second and third dependent. Yeah. Mhm.
Correct. How much do the test cost? Okay, how much do the test cost to have see you get the insurance? That will depend on your age, because from 50 to 59, they require some different tests than from 60 to uh, 75 and on. So yeah, you can send me the information and I'll send you, depending on your age, the program and how much it costs to apply for it with all the tests. I
Yeah.
heard they have inclusion.
Yeah, my
Oh
last
yeah.
one 3 years ago. when I changed was $97 for all the tests, all the labs they wanted.
Yeah, it can be around that. Someone is asking something that's very important here. I heard they have exclusions for anyone without COVID vaccination.
Mhm.
If you are over 60, they are asking for two vaccinations, and if you are over 70, is three. If you don't have these, you cannot apply for the program.
Yeah. Rebecca, this works in the hospitals she mentioned, and two in David and in Coronado and in um, Panama City, where you can take your card out and only pay your share. But if you're stuck somewhere, let's say you're in Chitray or like you're in Santiago and you need hospitalization, how does that work, Carla, as far as getting reimbursed?
Okay, you would have to pay everything. Is your,
Mhm.
let's say in Santiago, it has to be because of an emergency, and you can submit the bills. It will cover you the same. If it was an accident, the first $500 will be covered 100%.
Mhm.
If it was a hospitalization, they will cover you 70%, and of the all the procedures that are there. And this policy covers a maximum of 20 days of hospitalization per year, but it will be through reimbursement. You pay first and then submit the bills, and to
Perfect.
submit the bills is very simple. You can email them, and the reimbursement will be ready in about 30 days.
Yeah.
Great.
Okay. All righty. I want to thank you for joining us, Carla. And guys, remember with Magda is in Portugal. She's traveling back this week. And Carla, over 400 people were registered for this event. They all now have their email addresses. Give them a few days to reply because they might get a few emails for quotes and stuff like that. But feel free, any questions that haven't been answered regarding the insurance, Carla can help you. We're going to discuss more about Medicare and other in the public hospital system now. But thank you very much for joining
Muchas
us,
gracias,
Carla.
Carla.
Oh, thank
Good
you.
noche.
Gracias.
Thank
All
Buenas
you.
righty.
noches.
Okay. Thank you. Okay. One thing, Craig, we're doing a time change. Craig, we're gonna bring you on at 8 o'clock. And I do want to address Medicare again, folks. Okay. And I'm going to address this very strongly. If you're living permanently in Panama, Medicare with an Advantage plan is not a permanent solution for healthcare, especially if you've given up your home in the States. Number one, you have to lie every year on your taxes and on your Medicare application that you still live in the States because the Advantage plan is for US residents traveling abroad. Now, that could be an extended period, yes. It covers emergencies and once you're patched up, you're required, they'll only pay up to the point where you can travel safely home and get medical care back in the States. So I know a few people that have gone that route and have gotten in trouble and left with $10,000, $20,000 bill. You also have to have the cash in your bank if you want to be looked after by a private hospital here to pay the bill.
Yeah.
And like Medicare, they don't bill Medicare or Advantage share whatsoever. Okay, healthcare is good, guys. Our next topic, well, we're going to get to shortly, but we're going to finish on the hospital. Let's talk about, and then we'll get back to the final questions. Um, the public hospital system. You guys know it better than I. So I've been in them, but I've never been worked on in one.
The public hospital, it is very affordable. In some cases, is even free. For those that, for instance, maternity or deliver a baby or labor is all 100% free. Used to be a payment. My son Phoenix was born in a public hospital 10 years ago, and all they have to pay was a ridiculous amount of $150. And they still ask me if you want to do payments. These days, it's completely free on a public hospital. But
Right, but you are in a room with many other.
yes, that's where I was gonna go.
people,
So,
right.
so it is very affordable, but it has to be some glitches because it's public. So that means you have to share a room with many people, perhaps, And also, you need to speak the language or get by with the language, because there is a lot of people, or mostly 100% of the people in the hospital, they will not speak English. So if you're comfortable with that, if you want to get an appointment for a specialist, you can pay $1.50, easy, no problem. But you have to be in line
Wait your
5 in
turn.
the morning. Depends on where you are in the country. You might have to be at 5 a.m. in the morning waiting in line for your appointment, or but that's the struggle. It is extremely affordable, yes.
But you do have to wait your turn.
Yes.
So, but you could get lucky and there's no line to see the doctor you want to see that day. But there are people that go see a therapist every
Yeah.
other week at the public hospital, and they have to get there at 5 a.m. to be able to get in line and see him when he comes in at 8 a.m. And they might not see him until 10.
Yeah. But folks, there is a lot of good professionals in the public system. Many doctors, many specialists, they work in the public sector. Most of them work in the private hospitals. So
Most
if
of
you
the doctors
uh-huh,
split their time.
exactly. So if you are lucky, you might have the best specialist on the public sector, but it's like a give and take.
Mhm.
It's not as comfortable of an experience, but it's good care.
Yeah, and the another fact here is, for some reason, God forbid, you get in a major accident, you're unconscious, nobody knows you're injured or not. They will take you to the public hospital. They will save your life. They will do whatever it takes to save your life and bill you after. So that's one of the beautiful things about the public system here.
Yeah, definitely. You won't be denied access.
Do
You
not
won't be
be
left on the
denied.
street. But again, folks, it's not what you're used to in North
Mhm.
America.
Yeah.
It is understaffed. It is underbuilt.
In some areas, yeah.
Yeah, and
Especially in the remote areas.
it can be under medicated and under equipment. The
Mhm.
private hospitals have better staff.
Yeah.
Just all there is to it.
Yeah.
But even in the private hospitals, like Oscar and Megan recently had a baby Noah,
Mhm.
and just 6 weeks ago, right? Is it
Mhm.
7 weeks?
Almost
Almost
7.
seven.
Are we still counting by 7? Are we counting by weeks still? We're not into months yet. So in a basic birth in the private, correct me if I'm wrong, in the private hospital system is like $2,500, $3,000.
Mhm.
Right?
Yep.
Yeah. Like that's unheard of. A Magda, I wish I'm sorry about the technology there, but maybe after midnight her phone stops. Their sound, she's got it on quiet mode or something. So, and but she quotes different prices, what things cost in the private hospital, and knee surgery is like $14,000. There, like people in the States who are, and there's no wait. You could probably have it next week or the week after. So there are people in Canada I know go down to the States for stuff like that, and they might pay 30 or 40. Or people in the States with their insurance have to pay 15,000 on their copay and deductible to get the knee surgery. Get a vacation, come to Panama and get one.
Yeah,
Yeah.
and it's nice. It's a nice.
Wow.
It's a nice private room with 2 beds. Your spouse can stay there with you, and it's good care. And the food is really good, actually.
Yeah, it is. Filet mignon. Well, no, like filet mignon, but yeah, it is good.
Yep, if you're 49, no test required, and your health share. Let's go back here. I don't know if you guys can see this. You should be able to. 49 is $63 per month for the plan that we were just talking about with Carla. These are the prices right now, folks. It goes up to 125 for if you're 70. If you get approved over 70, which Carla said they just started doing, I mentioned on our a couple months ago in our Q&A that we were expecting this by November. I think their highest amount was 175 pre-COVID. I saw a couple of people had the same question. Do hospitals overcharge you when you use this type of insurance? Yes, they can. The best thing happened in the last couple of years in Cherokee that we got 2 hospitals in David, 2 separate hospitals now being covered by this insurance. So if you are planning a surgery, let's say you're getting a heart stent, you go to both hospitals and go to both surgeons. You actually get the price from the doctor and get quotes and tell them what they're doing, and they will be competitive against each other to help bring that cost down. I really hope in Panama City they bring another hospital in, but But you can get quotes from other places. You don't have to tell them first that you're using insurance. So there are ways to get around it. The private system is totally private in this country. So if you're shopping for a heart stent, go see if you have this insurance, get a price from San Fernando. Tell them, hey, I'm getting a price from Punta Pacifica. I'm getting a price from this place. And, then you say, oh, by the way, I'm using insurance. Haha. Okay. Okay. Let's see these last minute questions. Do you have to be in the country a specific amount of time out of the country for the family medical care? No, you can just pay your bills. And for the international, you must be a resident of Panama, meaning you stay here more than 6 months. Is Carlos? Yes, it can be used
Outside of Panama.
Yeah, outside of Panama, but it's on a reimbursement basis for emergencies only. And when you get the bill invoice to submit to a private insurance, I guess you could double dip like that, can't you? I think, yeah, you're probably going to get your bill for the 30%. I don't know if you get the bill for the full amount. That would be good. The Mensa hospitals, those are the ones Megan and Oscar were just talking about. They're called Mensa. That's our health department. What does Mensa stand for?
Ministerio de Salud Público.
Exactly. I don't know. There's no P in there. Yeah, the Mensa hospital is huge. There's two. One's a children's and one's a
Women and children.
Yeah, women and children's, and the other one's a men's. And they do that because there's a bunch of guys walking around with robes that are undone. So they separate the men from the boys.
Thank God.
What is the name of the hospital? San Fernando? Is that
Where?
The Coronado and
The clinic in San Fernando.
Yeah, San Fernando.
San Fernando.
And the phone number is right on the back of the brochure that you're going to be getting. Please answer it unvaccinated. That was answered. If you're between 60 and 70, if you're between 50 and 60, you must have 2 shots, vaccines. If you're over 60, you must have 3. If you're under 50, you don't need to be vaccinated. You don't need to be vaccinated for any of the international plans.
That's just for the family medical care.
Yeah. Yeah. And for the international ones, yeah, none. Easy to get an MRI. Yeah. If your doctor prescribes it, go get one.
Mm-hmm.
It's a matter of making an appointment. No more than, would you have to wait a week even?
For MRI?
Yeah.
And private?
Yeah.
No, it can be done in the same week. It's all about availability.
Yeah.
Your time, basically.
Okay. I can't find the edge here. There we go. Okay, we are going to start our next topic. This is what was going to happen. Right at 8 o'clock, all healthcare, hospital, insurance questions have to end. And we're going to talk about 2 more things, guys. Exciting stuff. We're going to talk about, I'm going to do this right now. At 8 o'clock, we're going to talk about health and hospice. And we're going to talk about veterans outreach programs for all your vets on the call. And we're going to talk about old folks' homes because Oscar's out there looking for one for me, apparently. But there is one thing to discuss here, and which is very interesting. Panama doesn't have a 911 system like you're used to. Number one, they answer the phone in Spanish and only know Spanish, their employees. So how are you going to handle that? Number two, not all rural areas are connected to the 911. So they might not be able to send you an ambulance and stuff like that. We live in Boquete, and that's the thing here. Fire department has a number, police has a number, and then there's 911. So it's just confusing for everybody. So there are private organizations set up to help us expats. This is the one that started years ago in Boquete. Rodney Direct. It's RODNY, rodneydirect.com. You'll get this brochure after the call. Now, what he does, he's a fully bilingual, him and his team, fully bilingual, 24/7 phone number to call in case of emergency. You can call it for an ambulance, for fire, for police, that the power pole fell down next door, that there was a car accident in front of your house, all those things, like, or that you were in a car accident and you need help translating to the police officer or the guy that hit you. Okay, it's $90 a year, so incredibly cheap. They find out where you live and you provide them several things to prove where you live, whether it's a GPS coordinate, it's the intersections, because we actually don't have addresses on our houses, or most streets don't have street
Well,
signs.
and Google shows up. It's
Yeah.
just in some towns, specifically here in Boquete, we don't have any signs
No.
for addresses. That they do exist. It's just there is not. There haven't been a proper planning to put the signs on the
And
houses.
no
or
one
the
uses
corners.
it here.
Yeah,
So this gives you a plaque for your front gate, whatever fence,
yeah.
that gives you a number. And with the GPS coordinates you provided, they can provide those to the police, fire department, ambulance, and they can get you help. It's a full list of benefits in there. You'll fill out a form and it'll have information like who is your pet sitter, what is their phone number, who's the person that who's your house sitter, just in case you're in an accident and you end up in a hospital. They will look after all that stuff for you. So don't be worried about that. Rodney Direct, his website still says Cherokee Helpline, but I was speaking with them earlier, later last week, and they do offer service throughout Panama now. And there are some other ones in Coronado area has one. What is it called? We'll have to get to
Coronado
that.
Helpline, something
Yeah,
like
yeah,
that.
Coronado Helpline. This is the one that's been around, I know, the longest. And most expats in Panama use this service. And it's something that if you move here, you're going to want to have. Okay. Okay. We are going good.
Mhm.
Hey, Craig, are you ready to turn on your microphone? Just click on the mic and the camera button. There he is.
I'm coming.
And there we go.
There he is.
Hey, Craig,
Hey.
how are you?
Hola, Greg.
I'm good. Buenas noches.
Buenas
Buenas
noches.
noches.
Yeah. So, obviously, we covered health insurance for the first hour, and I think we covered pretty well everything you need to know. But some of us, not including me, are getting old, and they're going to need help someday. So now, this is Craig Gatrell from Boquete Health and Hospice. We have him on because they are the model in this country right now. There are some other expat communities starting to, looking at getting something like this set up, and they're being advised by the Boquete chapter because Boquete, they're very strong here. Oscar, we've used them for some situations that we've needed for guests in the country and stuff. So, Craig, just briefly tell us, what is Boquete Hospice, Health and Hospice?
Okay. Well, thank you for having us. We started back in 2007, and one of the reasons that the organization was started was, a lot of us are coming here from our passport countries. We don't have family here. And a lot of us were expecting that, this would be just like, back in my passport country. There would be health and everything, hospice and stuff. And what we found was there really was not a hospice concept here. The country of Panama and even the medical organizations are learning more about hospice right now. It's too bad Dr. Shannon couldn't be on here tonight because she has palliative and hospice experience both, and we work with her very closely. But there are quite a few doctors here in Panama that do not have that experience or do not really understand the difference between palliative care and hospice care. And there's this concept that, here in Panama, families, when someone, is dying or is very, very sick, the Panamanian family takes care of them and then they don't need anyone else. That's true in a certain aspect. The Panamanians take very, very good care of their family members, but again, a lot of them are transient. We have a lot here in Boquete that are from Panama City, Coronado, Colon, other places in the country, and they need help just as well as those of us who don't have family here. So the original concept was to start a true hospice here. We were the first hospice organization in Panama, currently the only true hospice organization in all of Panama. There was one in Coronado that had to unfortunately close last year for lack of volunteers. And that was very, very heartbreaking to us because we had friends there and, who worked there. And unfortunately, they just could not get enough volunteers to have the organization continue running. So initially, we started out with only serving the expats because we did not have any Spanish-speaking people in the organization. Since then, we are now bilingual. We serve probably, I would say, depending on each month, my patient load is maybe 50 to 60% Panamanians, with the rest being expats, and that fluctuates depending on the month and the season. But we service both Panamanians and we service expats, and we've also taken, most are residents here, but we've also served some people like you mentioned. We've had some visitors to the Boquete area just on vacation or on one of your tours who've had health issues, and so we helped arrange to get them, to figure out who they need to go to the doctor, where do they need to do. We provided crutches and wheelchairs and things like that afterwards, after they've come back from hospital. So we work with the community a lot here. We are a true 100% volunteer organization. Many of our volunteers who came from their home countries are ex-medical people or ex-hospice people. And so we've got a wide range of people working for us. We're not licensed to practice medicine in Panama. However, we do follow all of MINSA, the Ministry of Health's guidelines. We work very closely with them. But we are not licensed to service here. However, what we do is we supplement the doctors, the medical facilities, the hospitals when someone has an accident and comes home, or if someone has been diagnosed with maybe a terminal illness, or they come back from hospital maybe after, say, open heart surgery, and they're going to be laid up for maybe, a month or so. We're there on the back end to help the caregivers, the family, and the patients. So that's our primary focus, is to provide that health and hospice support on the back end. We work very closely with the medical field here, the doctors, the hospitals. And we also work with physical therapists. When someone comes home after a broken hip, we've got people who help with that. They'll call us and we'll provide equipment and things to them. So we provide a wide range of services, but basically the main services we provide are health and hospice support services. We loan equipment. So, for example, if you break your leg and you need a set of crutches, there's no need to go out and, to do it or someplace and buy a set of crutches when we have them. We're more than happy to loan those out to people. We do provide equipment, all types of medical equipment. We provide blood services, which we'll talk about in a little bit, because blood is handled very differently here than most of you from where you're coming from in your passport countries. And then we also try to provide a lot of community education, such as CPR. One of the things we'll talk about in just a little bit is our being prepared services and our guide and how that works to train people, to educate people when they come here about that. We do education on slips and falls and, first aid and things like that. We'll be starting again this next year, working with like local restaurants and things like that, providing first aid training and CPR training for them, so that they can make sure their staffs are trained. So we try to provide as much community service as possible. So that's kind of us in a nutshell. Typically what happens is when someone has an issue or has a question, They call our main number, and it goes to me or one of the other two patient care coordinators. So we're staffed 7 days a week. And we're not an emergency service, but we do try to respond as soon as we possibly can. Once it comes to us, then we determine what the situation is and try to get you in touch with, the right people, or to provide some guidance. Or, for example, you've got someone who, we do get a lot of questions, for example, who do I go to? Where is this? So we provide a lot of those leads to people in the Boquete area. So once it comes to us, then depending on the situation, we'll deploy our hospice and home health care teams. We'll deploy our equipment teams. It may be setting someone up to get emergency pints of blood. We'll work with that. So we have one phone number, 678-19250, and you call that number anytime, and these guys will give it to you afterwards for sure. But you call that number and it always comes to one of us, one of the three patient care coordinators, and we'll make sure that we get your calls answered as soon as possible.
Cool. Let's move that quickly into that blood that you were talking about. Most of you people are used to Red Cross, Canada Blood Services. That don't exist here.
Yeah.
So how do you get blood? I got a surgery.
Well,
where's the blood come from?
Yeah, blood is handled very differently here in Panama. For example, we do not have like a national blood bank. We do not have the Red Cross here like what we have up in, say, the US, Canada, or other countries. So typically what happens here, let's say that you're not in a major metropolitan area like Boquete or Panama City. Chances are that there's not going to be blood available, or if there is blood available, you have to pay for it. And blood here typically can run in the David right now. The average cost of a pint of blood is about $300. And, a typical surgery, a doctor may want 6 or 7 pints of blood, sitting there waiting should there be an emergency during service, during the service he or she's providing. So sometimes what will happen in some of the rural areas, for example, if you were to go to a hospital and you needed blood, you would have to have someone come and donate equal amounts of blood. So for example, if I'm going into surgery tomorrow and my doctor wants me to have, say, 6 pints of blood, just waiting should there be an emergency during my surgery, then you would have to find, or I would have to find, some family members. I'd have to find friends, neighbors, people who can help donate that blood. So with that said, when we started in 2019, we started the first blood bank outside of a hospital here in Panama. So we work with a group, a blood department or bank in Hospital Regional. And what we did was we had our first blood drive to collect blood in 2019. And so when what we are doing is we basically have a bank. It's the same thing as you have a checking account. You have, $100 in your checking account that you can spend, and then you just keep, replenishing that. Well, that's what we do with our blood bank. We do 2 blood drives a year. And we've got one coming up in November. So if you're in the area and you would like to donate, we would love to have you donate blood. If you can't donate blood, you can always do our matching funds, because it does cost quite a bit to set up the blood drive and everything. But excuse me. What we do is we collect the blood, we work with the blood bank in Hospital Regional. So if you are living in the greater Boquete area, which would be like Boquete, Jaramillo, Portarreos, Caldera, the areas there. We don't go as far south as Dolega or David, but if you're up in our area and you have an emergency, or one of your family members or neighbors has an emergency, you can go to David. And as long as you tell them up front that you are with Boquete Health and Hospice, and that you're requesting your blood from Boquete Health and Hospice, then they will work with us. Now, typically what happens is when you have a blood emergency, you will contact us. I will send out a list of about 8 to 10 questions, depending on the situation, that you have to fill out. Basically your blood type. If you don't, the nice thing about Panama is if you have a driver's license, you have your blood type on your driver's license. That is so helpful. So you've got that. We need to know the doctor, the procedure, what the diagnosis is, all of this information, your cedula number, your residency, your passport number, all of that stuff. And then we go ahead and we activate our blood team. With that information, our blood team then in turn contacts the blood bank and hospital regional, and then they start the ball rolling to see what type of blood we need, when is it needed, which hospital. And even though our blood bank is in Hospital Regional, we also work with the blood can be transferred to May Lewis, it can be transferred to Hospital Cherokee, so it can go to any of the areas there, or any of the hospitals there. So then what happens is, just like back in your passport country, occasionally, the doctor, the medical staff will say, we haven't received the blood yet. Where's the blood? When's it coming? So you call us back, and we work very closely with the blood team at Hospital Regional. They are excellent. We tell them, and most of the time it's like, oh yeah, it's already there. The doctor just didn't know it. So we follow up and we make sure that happens. Just to kind of give you an idea, blood is very, very important. 1 pint of blood can help up to 3 people. Okay, and when we do the blood donations here, it's tested. You go in, your blood pressure's tested, everything's tested. When you go in, and then the blood is actually tested before it's put in the bank. So it's extremely, extremely safe. And so the protocols for handling blood and everything are, just top notch, just like they would be in any other country. Since 2019, we've collected over 347 pints of blood in the blood drives that we do. This year alone, we've collected 56 in June. And that helped, that was from 39 Panamanians and 17 expats. So the Panamanians are now starting to help us out with this as well, which we are extremely, extremely happy with. Our blood drives are bilingual. The staff doing the blood draws and helping, or most of them are from David, only speak Spanish. Most of them only speak Spanish, but we do have translators there who can work with you. So if you want to donate, we'll work with you regardless of what language you speak. Just alone in September, we had 9 blood requests, and we actually were able to help all of those 9 individuals. Awesome. So we were very, very happy with that. Again, the blood is handled a little bit differently here. One thing that you need to be aware of is if you do go to hospital here and you need blood, you don't want to pay for it up front, because a lot of times you need to tell them that if you're in one of the David hospitals that you are with Boquete Health and Hospice, and let them know that you're working with us to get your blood. But if you go ahead and pay, they will likely charge you $300 or more per pint of blood, and that's non-refundable. We have tried to negotiate with the doctors and the hospitals there to say, can we get that back for some of our patients? And we have not been able on that.
Okay.
So
well,
that's extremely important here.
Yeah. For those of you guys, about half of you guys are thinking about moving here. And I think almost half live here, because this information is just not given out what we, like regularly available. And it's so confusing. But many of you guys think about this. This is a great group we have in Boquete. That's why we want to bring them on here, give them more exposure. So the expats down in Coronado, you guys down in Petitcie, you guys in Panama City, can get a move on it. Start doing some of the stuff and start, do a bit of volunteer work and contact.
Yeah. Well, I'm next weekend there is collecting blood, so I'm gonna be next weekend.
Yeah, I made you at 11 a.m. So
11
you can
a.m.
sleep in, get your beauty sleep.
Thank you. Well,
Craig, one more big thing too.
Yeah, one of the other
What's
things
that?
that's important about blood is it cannot be transferred across provincial lines here. So, for
Oh, really?
example, if you were in you have an accident here and you need blood and you're trying to get it from, someplace in the province of Panama or Cocali or one of the others, it cannot be transferred here. Okay, and that's partly so that they protect the limited blood supplies that they do have in each province.
Makes
Okay,
sense.
and I noticed a couple of questions here, like the rules for blood donations. Blood is 65 here. You have to be 65 or younger here. Um, there's been talk that Mensa may change that, but as of right now, it is 65. There's also, I would say if you have questions, shoot them to me directly or send them to, the team here, and then they can get them to me, and I'll run them by our blood team because I don't want to misquote anything on that.
Yeah, we're going to talk about one more product that Health and Hospice is involved in. I think it's a very excellent product. You are in a foreign country. You guys are thinking about moving to a foreign country. And if you're moving here for life, that means you're going to die someday. So you guys have the only product that I've seen available. Prepare for the end. What's the full title?
I'm sorry.
Yeah, you guys have the product being prepared for the end of life.
Yeah.
Now,
What
this is
we
a
did,
book. It's both
okay.
a physical book that's sold for $10, and then the PDF download is also sold for $5.50. But tell us a little bit about this book. And as you're talking, I'm going to bring it up on the screen to show some people about it.
Okay. Well, first of all, when you move to a different country, it doesn't matter what country you move to, it's definitely going to be different. Healthcare, dying, the process of hospice, everything's going to be just a little bit different than what it was in your passport country. So several years ago, we had several on our team that decided to put together a checklist and a process of, when you get sick, if you have a terminal disease, how do you prepare for death and dying here in Panama? And how do you just prepare for basic emergencies? I need an ambulance tomorrow, or I mean today, how do I get an ambulance? Is there a local ambulance here? So I noticed someone asked, I think it was Carla, that these insurance programs cover burial plots here. So how is burial handled here? We were so happy about 2 years ago. We got our first crematorium in the province of Chiriquí. So we now have a crematorium in David, which is very helpful because before the bodies would have to be shipped to Panama City. So, and it was quite costly. So what our team did was they went out and they interviewed as many of the local doctors here and down in David. They interviewed police, they interviewed the bomberos, they interviewed different ambulance companies, they talked to Rodney Direct, and they talked to the funeral home. They talk to the tribunals. For those who are not aware, tribunals where you go for your marriage certificate, where you can get birth certificates there, and that's also where you have to file for your death certificates. So the tribunal is quite an important place here. And so they went to the tribunal and interviewed everyone there. And then what they did was they took everything that they had and they put it into this book calling Being Prepared. And it's a set of handy dandy checklists. It's about 27 pages. We have it available both in English and in Spanish. And it is what it is really a series of checklists. First of all, when you come down here, if you have an accident here, or if you die here, how does your family or friends back in your passport country, how do they know? How do they know who to contact? How do they know what your doctor's name is down here? So part of what this is making sure that you go through a very formalized kind of checklist of, getting all that information together that you can prepare with your family, your friends, or whoever your buddies are back in your passport countries. We also then have forms for you to put on your refrigerator here for your buddy here. Because, for example, if I were to slip and fall, hit my head, be unconscious, and one of my neighbors find me, what do they do with me? Who do they contact? Who's my family? Who's my emergency contact number? So we've got all of the forms in here to help you figure that out. Now, one of the things that happens a lot of times when people call Boquete Health and Hospice and they speak with one of us who are patient care coordinators, the first thing we're going to ask is, have you completed your Being Prepared guide? And do you have contact information? And does someone know where that information is in your house should you have an emergency? A couple of things that when I first moved down here and I completed mine, one of the important things that it doesn't matter where you live in Panama, but one of the most important things that you need to do is establish a contact with a local doctor immediately. It can just be going in and saying, hi, my name's Craig. I need a doctor here in Boquete, or I need a doctor in Coronado, or wherever you may be, but I want to establish a relationship so that we know each other. Why that's important is because if you do have a health emergency, you need to have that contact information readily available for a buddy, a friend, or a family member to contact that doctor. But it's also very important at the end of life too. For example, if a person dies in a home here, and an expat dies in a home here and has not established a relationship with a local doctor, unfortunately, the police have to be called, and normally an autopsy is done, which starts at about, depending, could be anywhere from $400 or above. Okay, and that in the country of Panama does have to do that because we have to then, if let's say you're from Germany, the German government's going to want to know, what happened to one of our citizens living in Panama. Was it an accident? Was there something behind this death or whatever? So Panama has to cover itself, rightfully so, on this. So if you do have contact with like a local doctor, for example, let's say Dr. Shannon, if you had Dr. Shannon as your local doctor and you were to die, then she would come out and she would announce your death at the home because she has a relationship with you. She would start the paperwork that needs to be filled out so that then your family, your buddy, your neighbors, whoever is going to help take care of you could then take that information to the tribunal to then start the process to get your death certificates. So it's just a little bit different process here than what a lot of us are used to in our passport countries. So the book is designed for Boquete in our area here, and it talks about our major hospitals down in David. However, this book is really, really good, and it would work for whether you're in Boca del Toro, whether you're in Coronado, Panama City, or wherever, because it gives you a good checklist. You would just need to find out what the local contacts are in your area where you're living. So it's a great step-by-step. One thing that a lot of things that we take for granted coming down here is, for example, your will, your power of attorney, your healthcare surrogate, all of those medical things and all your financial documents, they do not apply down here. So what we, in the book, we recommend that, one of the first things you do is to start looking at how you get all of your critical financial documents as well as all your healthcare documents. You get that set up and you speak to an attorney here to get all of that stuff filled out so that you are prepared in advance of an emergency. And you can take your local doctors, your will, your power of attorney, your do not resuscitate, or whatever you have in your own home country. You can bring those down here, and that's a good idea. And then you can take those to your local attorney here and say, this is what I have, say, up in Canada. This is what I would like to have something very similar here. And they use that as a starting point, and they'll create your documents for you.
Okay. All right, guys. So Boquete Hospice, hopefully soon to be Coronado Hospice, Pedicey Hospice. That'd be so cool, hey, Craig? But everything from loaning wheelchairs to canes to helping people through the struggles to the getting the blood to being prepared. Now, this book, like we say, currently Boquete Hospice was unable to collect. They're not collecting credit cards on their site. So we offered for the next 3 days to put this book, the PDF, for sale for $5.50 after the credit card fees, all 5 goes directly as a donation to Bocchetti Health and Hospice. So I put it in the link there. You will receive the PDF within 8 hours of your purchase, probably a lot sooner, actually, as long as I'm by my computer. And the link, you're going to be getting an entire page dedicated to Bocchetti Health and Hospice, about their programs, about their contact. If you want to start something in another town in Panama, get a hold of these guys.
Yes.
They will help you through it.
There is a huge potential to develop and increase more this type of service around the country, because I've been noticing in many other communities, the expat community has been growing. So there's a potential out there for sure.
On the package you'll get at the end of the meeting here is their website, and you can talk to them about donations and stuff like that if you'd like to help them out. But it's just good to know that hospice is available and a growing thing here in Panama. And good people like Craig are there to volunteer and help out. So thank you very much about joining us tonight, Craig.
Thank you.
Thank you so much.
How all this works.
And
stuff.
if you, one thing
Yeah.
real quick, if you do have questions about like health and, bringing a family member down who may be handicapped or things like that, please do give us a call, because we'll be happy to talk to you about a particular situation and, recommendations and things like that. And again, if we didn't get a chance to answer questions here, but if you do have questions, please feel free to give us a call or send us an email. We'll be more than happy to help.
Beautiful.
Perfect.
Thank you so
Craig.
much, Craig.
Okay.
Thank you
so
guys.
much.
Good evening.
Very, very kind of you for your time.
Yeah. Some of
Thank
the
you.
questions that I see here, we're still getting into in the last 15 minutes of this call. So we're doing good. Okay. We are. Last week, Oscar and I met with the Veterans Outreach. We get asked this a lot. What special things are there for veterans here in Panama? Now, it is segregated, of course. We got this end of the country. We got Panama City. We got Coronado. There's not one big organization looking after everything yet. So let's just take a quick look at this. This is another sheet that you're going to get in the email coming to you after this call. It has the direct contact information. Bochetti's Veterans Outreach, which is the largest in the country. And any of these guys will help you out. And let's say you're going to be in Coronado. Hey, who's my contact down here? Or I have some more information down here about places outside of Bocchetti. But what is a veteran? All veterans. So there's free membership to Bocchetti Veterans for people who live. I know they call it Bocchetti Veterans. It's basically Cherokee, it seems. Like all around here. They'll give advice. They have events. They have a newsletter. They get together, and that's for veterans of any country. Now, veterans in the U.S., you guys, like your country actually, better than my country, Canada, kind of looks after your vets even more than Canada does as far as medical. Like some of you guys are retired early, or you're on a disability pension. There is some health care available for you here. Now, I can't answer anything specific to each individual, because you need to, first of all, if you're moving here, you need to know about FMP. Oh, yeah. You need to register for the FMP program before you leave the States. If you've already done that, you moved here and you're a vet with some assistance, then just contact the Bocchetti Veterans to help you register. Because if you have a medical condition caused by your service, it can be paid for here. Now, how is it going to be paid? Is it going to be paid for upfront, or is it going to be paid for with reimbursement? That all depends on your situation. And like if you're a retired vet, your TRICARE might pay for all your medical here. And it's not the hospital that determines how you get paid. It's actually the doctor here. It's kind of weird whether he's going to take your insurance or not. TRICARE for Life is known not to be fast in paying their bills, but some hospitals, ask their doctors to take it, and they do. and so you can have treatment up front. But a friend of ours recently had a back surgery that was covered under his service connected condition, and he had to pay out of pocket, but he was paid back within 30 days. So if you're a vet, all the contact information is on this sheet for you. Talk to these guys. If you're outside of Boquete, you're coming nowhere near us, check out Healthcare Alliance. I put their website in there. They'll look after you in Panama City, Coronado, with all these questions you have here. So the information is there right from the government. And Oscar and I didn't make this up because we know nothing about veterans, but this all came from a little meeting Thursday night. They also couldn't make it tonight. But yeah, there may be some services for you. There may be some medical care there for you. So yeah. So let's just see, guys. I know we got a couple minutes here. We're going to end it. I know we're going to go a little bit early, but I'm just going to put this in Q&A mode for a second here, just to see if we missed any major question that we can answer. Or Will's, that was kind of answered. How do we get the book? Not the Nook. Let's donate 20. No, the book is $5. And how much do I get to donate my blood? Yeah, I don't know where the blood comes from that they charge $300. I just learned that from Craig. That's how much it costs to get blood here.
Because they have to cover all the fees for keeping it. It's an operation.
Yeah. Got some good questions here.
Filtration, tests. That's why.
Panama jungle question. The blood range. Okay. Physiotherapist. Oh, lots of physiotherapists. You guys have a
I'm ready to get some
physiotherapist,
blood
don't you?
next week.
Yeah.
You participated in the first one
Huh?
that they did, the
Yeah.
first blood drive.
Yes, I did. I have done it twice with them.
Mm-hmm.
Okay.
Last time I donated blood for a good friend of mine here in Boquete.
Okay. Since there's still 100 of a few of you hanging out around here. Our wills from the USA. Nope, you have to have it rewritten here. It's basically going to be about the same thing, but it has to be written in Spanish and notarized in this country.
Mm-hmm.
Now, how do you get the book? Again, just look. It's in the body of the email that's going out as soon as we end this call in a few minutes. And it's $5.50, and it will be emailed to you within 8 hours of you purchasing it. Like I go to bed at 10, so if you order at 10,
So
it
you
won't be
say
emailed till
$500 or
6.
$5?
$5.50.
Oh my God!
It's a
You don't have to buy a
donation.
book for $500.
Did I say $500?
Yes, you kind of said it in the beginning.
I'm 65. Is it 65 and under? Okay. Now, I was told you can donate up to your 65th birthday, I believe is the right
Yes,
answer.
it is the
there.
answer. Yes.
Okay. Any info on dental care? Let's talk about dental care a little bit.
Yeah, we have a great dentist here in Boquete.
Yeah. Insurance that not covered.
Right.
However, it's very affordable, very high quality here in Panama.
A cleaning is usually $40, and it's
Yeah.
actually the dentist who does it.
Most of it, yes. Pretty much. And a crown, like $200, $400? Yeah, it's really affordable here. Now, we have a great professional, couple of great people, dentists in Boquete. And if you want to just go, like we call in Panamania, Yeye, bougie, or like high, you go to Panama City,
Huh?
you get a lot of like a really high end in the clinics.
Oh, yeah. Yeah. Panama City's got some great dental clinics. Someone mentioned implants there. We might not be as big as Mexico or Colombia in that type of a business, but it's really growing.
It is really good. It is really good.
You could probably, get a nice vacation to Colombia and have it done cheaper and include the flights. But there is, like, compared to the U.S., yes, some great price. And I know people doing implants and stuff in Panama City.
Mhm.
Okay, a couple more questions because people want to stay. So, how do people with mobility issues get around? Slowly. It's difficult.
It is difficult if you're a handicapped person. In some areas, sidewalks are limited or non-existent.
Motorized scooters almost impossible in most of the smaller towns.
Yes, yes. So the best way is to have a vehicle modified,
Yeah.
or have somebody to take you around.
Or someone pushing you in a wheelchair.
Oh,
so you can
somebody,
get around.
yeah. Because even though in some areas that we don't have walking bridges, but the walking bridge doesn't have the ramp; it's just steps.
Yeah.
Pretty much have to ask everywhere that you're going.
Exactly.
Is it wheelchair accessible?
Uh-huh.
Is there
By-
a ramp? Is there an elevator?
Yeah, by law, businesses should have a handicap access. However, that doesn't mean every single place is gonna have a handicap access. So
Yeah, businesses building new have to have the handicap access,
and the parking
handicap
spot.
bathrooms, the
Mhm.
parking, but they haven't quite yet done the existing businesses.
Uh-huh.
Yeah.
Yes.
There are restaurants, fancy, beautiful, high-end restaurants that I've seen here that the bathroom's 2 feet wide.
Mhm.
Okay, like I'm sorry, like it's just
Yeah.
so that will come. Is there an age limit for pensionable program visa? Nothing to do with healthcare, but I will certainly answer you. Yes, you must be at least 18 with a pension for life. I know that sounds funny. There's no age limit on the other
No.
end. No. Vision care, same thing with dental care. As we said, there's no insurance programs here to cover them because the cost is so low.
Yeah.
Yeah.
Any appointment for the automated for the eyes is gonna be 30, 45 tops for
That's the
an
most I paid,
appointment.
$30-some.
And then there is, however, here's some places you have to specify if you want to get the prescription. So you make sure you talk beforehand, because what happens, what I have learned, some places they say, oh, the freak, the consultant, because they want to make the monies with the
Oh, yeah.
glasses.
That's
They
right.
don't give you the prescription.
Oh yeah, that's right.
It
Well,
just
that's the
happens.
same. It's the same in the States. That's
Okay,
it. When they
because
promote that.
today I went to PriceMart and I saw a little booth where they do eye tests. I said, oh, hey, I mean,
Free eye test.
how much?
Yeah.
No. I asked
Oh.
you how much it was gonna be. I need a prescription because I just want to have the freedom to check out where I want to get my glasses. He said, no. Here's free. You can, but you have to get the glasses with us.
Yeah.
Yeah, that's the price.
So also, when you get older, cataracts can be 12 to 1,500. I've the last I heard was 1,500, and that was Lourdes in 2019. That's the last person I know that had cataract surgery. So it's affordable. Insurance will cover your cataracts. The two insurance policies we had, if after 24 months, I believe it is. What can I find on nursing homes? I was wondering when we'd get this question. We usually always get this question. Okay. This is a challenge in Panama because it's not a Latin American thing to do. When the parents get old, they move back in with the kids, or the kids move into their house and they take over the house. And
Or they rent a place, or they live in their place and they just hire somebody to take care of them.
yeah, or they already have a maid's quarter in their house and they bring in a nurse or a nurse what's it called? Nursing technician, they're called here in Panama. Now, there are some nursing homes. I'm going to tell you how limited this is. The only one that both, I've talked to hospice, Dr. Rod Gupta, we spoke to him today. He's a retired doctor from the U.S., but living in Boquete now, involved in a lot of the volunteer stuff. And there's one decent one. They have a home here in Boquete. It's got 8 beds. They have one in David, 24 beds, and one in Panama City, 48 beds. That's the biggest one in the country that these people know of. And that is full from partial to Alzheimer patient. Like they can handle it all. Here's the issue though. They are Spanish run and Spanish spoken. Even the one in Panama City doesn't have any English workers. Up here in Boquete and David, the administrator speaks English and one of the staff do. But in Panama City, they're using Google Translate with their patients. But I can tell you what the price is going to be. I got the prices right here, and it's cheaper in Panama City and David. Here in Boquete, it's $850 a month for double occupancy, so you got a roommate, and $1,000 a month for single occupancy, and that's for full care, 3 meals a day, full care, a doctor on staff, checking you out all the time. So it's very, very affordable. But I really know what's going to happen here because expats started moving to Panama 20, 25 years ago. Well, they're now in their 80s. So if there's a need for it, they will bring up more North American style home care.
Yes.
And of course, they can afford to charge double. They can charge $2,000. They'll have translators. It's still going to be staffed by Panamanian nurses. There's nothing wrong with that. They know what they're doing, Panamanian doctors, but they need translators involved. They need the activities to make it more comfortable for an expat who doesn't speak the language to end out their days. But I really think when you buy your home or rent your last home here, get the one if you're in your 80s, get the one with the bedroom and the extra bathroom and have live in health.
Yeah.
It's really not. It's actually probably live in health is a little cheaper than what we just talked about here. About the same, $850, $1,000. Yeah, for a good. I'm talking good quality help. I'm not talking a maid,
Right.
like just a maid. I'm talking about a nursing technician that would live in your home.
All right.
All right, guys. What do you thought about self-insuring? I answered that one very quickly. Have $100,000 for each of you in the bank that you're not going to touch and that you can access immediately. Then go ahead and self-insure. That's be really like a major cancer. It could be $60,000, $80,000 by the time you're done over two years. These are $500,000 things in the U.S. So, yeah. Mm-hmm. The government does not get involved in hospice, blood, or home care whatsoever in Panama at this point. So there are no government operated facilities. They are all private. Okay. Thank you for attending, guys. Woohoo.
That was great. We went
Yeah,
over a lot
last
of
minute thoughts?
information.
Oh yeah, this was Oscar and I promised we're going to get to sit down before Christmas with a doctor or two from Panama to get some of those questions answered, do a Q&A. But in a line of profession like Dr. Shannon, these things happen.
Yeah, sometimes it's complicated to get
you have an emergency. You have an emergency that I don't know what she's doing. It's none of our business really, but it's hopefully.
Well, we kindly appreciate you all to attending this Q&A tonight. I hope that all information has been helpful and useful for all of you. You only have to do some of you perhaps to the expense of the $5 only, but that is a good information. Looking forward for the next Q&A. What's going to be your next Q&A?
Our next Q&A is posted. Oh goodness, I can't tell you. It's two Mondays from now, a general Q&A.
All right.
But remember, those of you thinking of coming here, come with us. We just had a spot open in December. We want to fill it this week.
Yeah.
That's exciting.
Yeah, we didn't say we're going to promote. However, we get a last minute. There's only 2 spots for December.
Yeah.
You want to come and treat yourself before the
Go to retireinpanamatours.com. You now know what we're like and what we do, and we will show you this country.
Yes.
So on that note, we're going to say goodbye. We do have a message from our sponsor. Someone's got to pay for this, right? Good night, everyone.
Good night, everybody. Have a good night, everybody. Thank you for your time.
I assumed we had a message from our sponsor. Our sponsor, there it is. Nope, that didn't work. Oh, well, we were just going to give you an ad of Oscar talking about the tour. All right, guys. Talk soon. Later, that email with all the content will be there within minutes of me pushing this button. Bye-bye.
Buenas noches.
Buenas noches.